I am absolutely thrilled to be here with you this morning, especially at such an important moment in our history and for our communities. This is really a serious time in our country's history. Too much is at stake for all of us in terms of equality, freedoms, and economic stability. So today, I want to talk with you about our individual and collective role in this decisive moment, in particular, our influence as a Latino community. We're looking at two radically different visions for our nation's future at a moment when we are facing serious problems as individuals, families, communities, states, and as a country. This moment calls for not only intentional reflection on the problems that we face, but also who we are as a nation and what we want to become. We have a say, and this moment calls for a committed, collaborative leadership from every one of us. Our families, communities, a nation need the very best of us to guide us to real solutions that result in the ability to continue dreaming, striving, and working towards a brighter future. With you today, I want to have an open and honest discussion about the problems we face. And in doing so, I want to focus on those that are unique to our communities. While the candidates may be focusing on providing the national perspective of the nation's challenges, today I want to get specific and focus on the problems that are near and dear to all of us, those affecting our families, and particularly our older community members. As part of our discussion, I also want to talk about leadership, how each one of us has a calling this very moment to lift up our unique voices and together build the America that we dream of for the 21st century. I am making such a commitment, and I invite you to join us. In fact, our discussion here today begins the process of a larger movement, lifting up of the plight of suffering of Hispanic older adults across the country, ensuring that issues impacting this vulnerable segment of our community get the attention they so much deserve, and that our elected officials are held accountable to our concerns. The time to ponder about our problems was yesterday. Today, we will be discussing the issues to identify real solutions and a clear direction forward that includes all Americans. One that all of us support and can truly begin to say that we live in a stronger golden America, an America that takes care of its own, an America that values the contributions and hard work of older adults, an America that continues to provide its people with the promise of the dream our parents and grandparents fought for to give to us and our children. It's time for us to come together to build this America for our elders, ourselves, and the generations to come. After all, what we do for our elders only protects us as we age ourselves. In 2005, when I came on board with NHCOA, the aging field was thriving, talking about the growing aging wave, how we must work to strengthen the aging network to be able to adequately serve the increasing number of seniors in the country, how we must prepare for the reality which we're experiencing today. I am sure you know that since the start of 2011, and for the next 18 years, an average of 11,000 people will turn 65 years old every day in the United States. And of those celebrating this milestone birthday, an increasing number are from diverse communities. In fact, according to the US Census, diverse communities will comprise 42% of the 65 and older population in 2050, which is double today's numbers. In particular, the percentage of Hispanic older adults will increase sixfold, from 7% to 20%. Think about it. These statistics tell us that older Americans will represent a larger portion of the US population. They also tell us diverse Americans will represent a much larger portion of the US aging population. This is the same population that many want to cut out of the political agenda. So what do these numbers mean to us as young professionals, as parents, as field experts, as advocates, and as older adults? In order to get a more accurate picture of how the growth of the U.S. diverse aging population impacts us both today and in the future, NHCOA traveled to different regions of the country to take the pulse of the community. Through the Promoting Communities of Success regional meetings NHCOA holds to educate Latinos about the civic process, we heard from hundreds of community members about their concerns. I want to share with you some of the insights I gained because I made a promise to myself and to the older adults I met along the way that I would give a voice to their concerns, to ensure that those who have the power and influence to make changes hear these concerns for a more accurate perspective about their reality. Many are living on the outer edges and in the dark corners of our society, facing significant challenges in all indicators of well-being, economic security, health, and housing. About 18%, or 1 in 5 Hispanic older adults, live below the poverty line. Many more live on the edge of poverty. Without Social Security, 50% of Latino seniors will be in poverty. As it is, many rely on the benefit for 90% of their income. This is significant because Social Security payments to Hispanic older adults are quite small, averaging well under $13,000 per year. Older adults that NHCOA spoke with during the regional meetings were often living the story told by these statistics. In California, Florida, and Texas, older adults talked about going to bed hungry because they only ate 1 meal a day. Many have to negotiate between basic necessities because their limited budgets don't allow them to cover all their needs. I spoke to a woman in California, for example, who received her Social Security check totaling $841 per month. Out of this check, she had to pay $810 in rent. You can do the math. Many do the unthinkable, including skipping meals and essential medications in order to be able to meet other basic expenses. About half of U.S. Hispanics own their homes. Yet Latinos spend a much higher percentage of their salaries on housing and are more likely to live in substandard housing than the larger population. Hispanics pay 46% more of their income on housing than the rest of the U.S. population, and yet are only slightly more likely to report receiving rent subsidy than the larger population. Latinos enjoy about 35% less square footage per person in their homes compared to the overall population and are more likely to live in housing that is in poor physical shape. During our regional community meetings, the Hispanic older adults we met also talked about extreme high burdens of housing cost. Many also talked about living in unsafe neighborhoods, being forced to move in with adult children because of economic demands, or having deplorable housing conditions. A senior in Florida told me it took months for the sole maintenance person in the building with dozens of units to repair leaks in her apartment. Others said they had holes in their walls and broken air conditioning. Another older adult described how the elevators in his building were in such bad conditions that they would break down constantly, often trapping seniors inside for hours. Many of these same individuals and others we spoke with have experienced extremely high levels of foreclosure during the housing crisis. As a result, they distrust banks, recognizing they were targets of predatory lending practices that now have left their futures full of uncertainty. Social Security and housing are just the tip of the iceberg. As you know, Hispanic older adults face a number of health inequities, just a few to point out. Some conditions, including diabetes and Alzheimer's, have a rate among Hispanics of about twice that of non-Hispanic whites. This is compounded by a relatively high rate of uninsured, almost 5.5% compared to less than 1% of the general population. Hispanics in general lack access to preventive care. Hispanic older adults are less likely than other older adults to have received adult vaccination or recommended screenings. About 15% of all Hispanics have delayed health care, and 13% have declined to purchase prescription medicine due to high cost. At our regional meetings, many participants share with us they experienced early hospital discharges and needed to be readmitted. Many participants talked about feeling humiliated when receiving services, either because the provider treated them inhumanely or because they felt they couldn't communicate properly. They stated that there's a great need for cultural and linguistic competence among social service providers. These situations engender a sense of isolation that not only exacerbates older adults' overall health, but also keeps them withdrawn from their communities. This isolation opens the door to discrimination in a whole spectrum of abuses and fraud, from mental and physical to financial. These severe issues not only affect our elders, they are issues that impact our entire community. As long as these injustices exist, more pressure is placed on the next generation to succeed. That generation is us, the sandwich generation, a term that is taking on a whole new meaning. Many in this generation must step in and provide for their older family members with the care and security they need, despite struggling with economic insecurity themselves. And let's not forget their responsibility of raising their children too, our communities and country's future. How will our community ever reach its potential if these issues are not addressed? Cuts in critical programs like Medicare, Social Security, and Medicaid may be felt more severely by us in the not too distant future among generations to come if we're not smart as a unified voice. And so we come face to face with the task at hand, with a deeper glimpse of the issues and realities facing Latino seniors across the country. It's time to roll up our sleeves and do our part. We're not simply called to overcome faceless forces of the economy and the trends of the times. We're also facing negative political will that hurts our community's viability and seeks to diminish our role in society. It's that straightforward. These forces will test our strength and resiliency, but together we can confront them successfully. Without our voices being raised, narrow perspectives will rule our nation and will achieve cuts in critical programs that help older adults, will prevent implementation of the Affordable Care Act, will suppress voter participation, and will encourage community-wide abuses originating from prejudice and extreme anti-immigrant sentiment. To tackle these negative forces, we need leadership at every level. We need leaders who are our own, representing our communities at the local, state, and national level. It's unacceptable that non-Latinos are speaking on our behalf. Our leaders, however, must approach the issues from the side of positivity. We must be proactive, pro-country, pro-community, pro-elders. We must also be pro-diversity, because it's what makes our country great and aim for the bright future for which we all strive. Let's challenge elitist forces with positivity and inclusion, and the forces of hate with love. You see, we can all benefit when tides rise. And so, we must nurture our leadership to not only be our own, but to be a role model of which we can be proud. A positive influence that inspires communities of every race, religion, and creed across this great nation. A positive leadership that is driven by healthy morals and values. A positive leadership that looks for the common good, that leaves its ego at the door. A positive leadership that goes beyond promises and it's rooted in action. A positive leadership that motivates and empowers others to take charge of their lives and destinies. A positive leadership that is sincere, engaging, and reflects our interconnectedness as families, communities, and a country. We may come from different countries of origin and have different cultural norms, but we have a common language and history that defines us. We are interconnected. The second strength is that we hold on tightly to our values. Our shared values are plenty and firmly rooted. We are committed to our family. We respect others. We care for and love our elders. We help each other. We serve our neighbors. We practice our faith. and we are known for our resilience and work ethic. These values provide us with the strength and opportunity to help ourselves and our country.